Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gastroenterologist talking to a patient called Mr. Harris. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Harris. It's nice to meet you. I see you've been referred by your GP regarding some digestive concerns. Is that correct?
Yes, that's right. I've been experiencing stomach pain, bloating, and sometimes I just feel tired for no reason. My GP mentioned it could be something related to gluten.
That's helpful to know. Based on your symptoms and what your GP noted in your file, one possibility is celiac disease. Celiac is an autoimmune condition triggered by consuming gluten, which is a protein found in wheat, barley and rye. But first, let's go over your symptoms a bit more. How long have you been feeling this way?
It's been on and off for a couple of years, honestly. Sometimes it's mild, but other times I'm doubled over with stomach pain. I also feel incredibly tired most days, even after a good night's sleep.
That must be challenging. Fatigue is indeed common in celiac disease, along with symptoms like bloating, diarrhea, and sometimes nutrient deficiencies because of poor absorption in the gut. Do you experience any skin rashes or unexplained weight loss?
I've had a bit of weight loss, but I thought it was just from stress. And yes, I do sometimes get itchy rashes on my elbows and knees, but I didn't connect it to my stomach issues.
That's insightful to mention. The rash you're describing could be a condition called dermatitis herpetiformis, which is common among people with celiac disease. It's an itchy, blistering skin rash that can appear on areas like the elbows, knees, and sometimes the buttocks. Together with your other symptoms, this strengthens the suspicion of celiac disease. However, we'll need to confirm with a few tests.
What kind of tests are we looking at?
The initial step is a blood test to check for certain antibodies that are typically elevated in people with celiac disease. If the blood test suggests celiac, the next step would be an upper endoscopy with a biopsy of the small intestine. This helps us assess any damage to the villi, which are the tiny finger-like projections lining your intestine. They absorb nutrients, and in celiac, they often become damaged from the immune response to gluten.
Is it a serious condition if I do have it?
Celiac disease is quite manageable with lifestyle adjustments. However, if left untreated, it can lead to complications such as osteoporosis, anemia, and in rare cases, an increased risk for certain cancers. The good news is that once diagnosed, managing it effectively involves following a strict gluten-free diet. This diet helps alleviate symptoms and allows the intestinal lining to heal.
I see. So, I just avoid bread and pasta then?
Yes. But gluten can also be hidden in unexpected places, such as sauces, marinades, and even some medications. Reading labels becomes a part of daily life for most people with celiac disease. Gluten-free alternatives are widely available now, though, which makes the diet easier than it was a decade ago.
How soon would I start to feel better if I do have celiac and cut out gluten?
Many patients notice an improvement in symptoms within a few weeks of starting a gluten-free diet, although full recovery of the gut lining may take longer. It's essential to stick strictly to the diet, as even small amounts of gluten can trigger symptoms and ongoing inflammation.
And would I need follow-up appointments after the diagnosis?
Yes, definitely. We'll want to monitor your recovery and check your nutrient levels periodically, since people with untreated celiac often have deficiencies in iron, calcium, and certain vitamins. Following up ensures that your diet is meeting your nutritional needs, and we'll also check on any ongoing symptoms you might have.
Makes sense. It sounds like it might be a big change, but if it helps me feel better, I'm willing to try.
I'm glad to hear that, Mr. Harris. It can feel overwhelming initially, but many people with celiac disease lead full, healthy lives by making these dietary adjustments. There are also great resources, like dietitians who specialize in gluten-free diets, to help guide you.
Thank you. I feel better knowing there's a clear path forward.
Of course. Let's start with the blood test, and I'll have my team follow up with you once we have results. If you do have celiac, we'll walk through all the necessary steps together. In the meantime, don't hesitate to reach out with any questions.
Thank you. I'll get the test done as soon as possible.
Excellent. I'll be in touch soon, Mr. Harris. Take care, and we'll talk again soon.
Extract 2, questions 13 to 24. You hear a GP talking to a patient called Ms. Suhana. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Miss Suhana. It's good to see you.
Hello, Doctor. It's nice to see you too.
Today's a routine checkup, so let's go over how everything is going. How have you been managing lately?
Well, to be honest, not too great. The pain seems to be getting worse, and it's really affecting my day-to-day life.
I'm sorry to hear that. You have osteoarthritis, correct? I believe we diagnosed it around a year ago?
Yes, that's right. And at first it was manageable with just some over-the-counter medication. But lately the pain has become quite constant, especially in my hands and knees.
I understand. Has there been any change in your mobility or any new symptoms besides the increased pain?
Yes. The stiffness has gotten worse in the mornings, and sometimes it lasts for hours. By the time it eases up, I feel like half my day is gone. And even when the stiffness goes away, my joints feel swollen, and I'm constantly exhausted.
That sounds very challenging, Miss Suhana. Morning stiffness and fatigue are quite common with arthritis as it progresses. I'd like to go over some treatment options to help manage these symptoms better.
That would be great. It's starting to affect my mood too. I just don't feel like doing much these days, even though I used to love activities like gardening and taking walks.
It's understandable. Chronic pain and restricted movement can be very draining. I'd like to ask, have you often felt low, down, or frustrated because of your arthritis?
Yes, absolutely. Sometimes I just feel defeated. I used to be so active, and now I have trouble even getting through a normal day.
I'm really sorry to hear that. It's common to feel this way when dealing with chronic pain. Many patients with arthritis experience periods of low mood or even depression. There are options for managing both the physical and emotional impacts of arthritis, and I want to support you through both.
Thank you, Doctor. I was wondering if there are options beyond just pain medication. I'm trying to avoid taking too many pills.
Certainly. For pain management, we have a few alternatives that might help, such as physical therapy, which can improve mobility and reduce pain. We could also explore targeted exercises, like gentle strengthening and stretching, which a physical therapist would guide you on. Some patients also find relief with hot and cold therapies or using assistive devices.
I think I'd be interested in physical therapy. I want to do whatever I can to stay mobile.
That's a great approach, Ms. Suhana. Physical therapy can be very effective in improving function and minimizing stiffness. There's also the option of an anti-inflammatory diet. Foods rich in omega-3s, for instance, have been shown to reduce inflammation. I could provide more information if you're interested.
I've heard about that. I'd be willing to try dietary changes if it helps with inflammation.
Perfect. I'll get some information for you on that. Additionally, if the pain becomes unmanageable, we could look into joint injections as an option for targeted relief. They're typically effective for more severe pain, but I recommend them as part of a comprehensive approach.
That's reassuring. I was also wondering, is arthritis linked with mental health? I just feel so drained, and I'm not sure if it's only from the physical pain.
Yes, arthritis and mental health are closely connected. Chronic pain often impacts mood and energy levels. To help manage this, some patients benefit from counseling or cognitive behavioral therapy. It can offer coping strategies for dealing with the day-to-day challenges and emotional impact of living with arthritis.
That sounds helpful. I hadn't thought about therapy for arthritis, but I'd be open to it.
I'll be happy to refer you to someone who specializes in counseling for chronic conditions. Additionally, if fatigue is a big concern, we could run some blood tests to rule out other issues like low iron levels, which can sometimes worsen fatigue.
Thank you. I think a holistic approach could really make a difference.
Absolutely. I'll coordinate with the physical therapist and counselor so that you have support on all fronts. Also, let's set up regular follow-up appointments to monitor how you're doing and make adjustments as needed. You won't have to face this alone.
I appreciate that. I really feel like you're listening, and it helps to know I have options.
That's what I'm here for, Miss Suhana. Let's take this step by step, and we'll work together to manage your arthritis as best as possible. Is there anything else on your mind today?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a healthcare researcher discussing disparities in healthcare access with a community leader. Now, read the question.
So, we've looked into various factors that impact healthcare access across different populations. Often, we see that racial, ethnic, and socio-economic groups face significant challenges, which can affect their overall health outcomes.
So, does that mean some communities are just not getting the care they need?
In some cases, yes. For example, lower-income areas often have fewer healthcare facilities, and even when available, the quality of care might not be the same as in more affluent areas.
I see. But is there anything we can do to start improving this situation?
Well, yes. We're actively working on programs to make healthcare more accessible and to ensure quality standards are met across the board. By promoting health equity, we hope to close some of these gaps.
Now look at question 26. You hear a podiatrist explaining the treatment of a patient with onychographosis. Now, read the question.
Been experiencing discomfort for several months and struggled to manage these nails herself. I first assessed the extent of the nail growth and curvature. Given the thickness, I decided to carefully grind down the top layers of the nails and reshape them to a more manageable length and shape. This approach relieved her discomfort significantly, but ongoing care will be necessary to prevent further complications. She will need to come in for regular podiatric checkups to maintain her nail health.
Now look at question 27. You hear a nurse explaining essential techniques for wound care. Now read the question.
Good afternoon, everyone. Today, I'm going to explain the essential techniques for wound care and proper dressing changes that we will be following from now on. In the past, wound care procedures varied significantly from one nurse to another, leading to inconsistencies in patient outcomes. Often, wound care was performed without sufficient communication with the patient, which sometimes caused confusion or anxiety for them. As many of you know, we have had reports of delays in wound healing and patient complaints about discomfort during dressing changes. The main reason for this new protocol is to prioritize patient-centered care by involving them actively in the process, educating them about each step, and addressing their concerns during the treatment. By doing so, we aim to foster better healing and ensure patients feel more secure and informed throughout their recovery.
Now look at question 28. You hear two colleagues talking about a training program. Now read the question.
So, what did you think about the training on CPR and emergency response, the one from last Wednesday?
I thought it was quite informative, but it could have covered a few more advanced scenarios. For instance, I appreciated the section on the changes in CPR guidelines, because those are updated frequently. It was very practical to review that.
Agreed. What did you think of the part on basic resuscitation techniques?
It was quite fundamental, obviously, but considering the range of experience in our team, I think it was good for some of the newer staff who haven't had as much practice with emergency response.
True, I hadn't really thought about it that way before, but now that you mention it...
Now look at question 29. You hear two nurses discussing the discharge process for patients. Now read the question.
Hi, Sophie. Can I ask you something about discharges?
Sure, Mark. What's up?
I'm helping a patient get discharged, and I want to make sure I've completed everything correctly. Have you done the new discharge documentation process?
Yeah, I went through it yesterday. It's meant to be straightforward, but it took a bit of time to get all the forms together.
Did you have any issues with the forms or the checklist?
Not really. The checklist was long, but I got through it. Just make sure to double-check that everything is signed and dated. Why are you having trouble?
Well, I keep getting reminders saying I've missed a step, but when I check, everything seems to be there. It's really confusing.
Did you call the admin support team to see if there's a glitch?
Yeah, they said everything looked fine on their end, but I still get the notifications. I'd rather not have to go through the whole checklist again.
You really shouldn't have to. Maybe just email the discharge coordinator to let them know you've completed everything. They should be able to verify it and stop the reminders. Now look at question 30. You hear a trainee nurse receiving feedback from her tutor about a patient discharge she has just completed. Now, read the question.
With the patient.
I think I could have explained the discharge instructions more clearly. I went over them, but I think I could have checked if he understood everything.
Yes, that would have been ideal, but it's great that you recognized it. Communicating clearly and confirming understanding is so important, especially at discharge.
Thanks.
Overall, you did well with organizing the paperwork. You ensured the medication list was up to date, checked that the follow-up appointment was scheduled, and reminded him of the dietary restrictions noted in his plan.
Yes, I made sure all the instructions were included.
And you could have encouraged the patient to ask questions if they were unclear, but it's good that you documented everything thoroughly and signed it off.
Thank you. I'll work on improving that next time.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a medical professional giving a detailed presentation on prenatal stress and its impact on fetal development. You now have 90 seconds to read questions. Welcome everyone, and thank you for joining today's training on prenatal stress and its impact on fetal development and mental health. This topic is essential in maternal and fetal healthcare because maternal stress during pregnancy can profoundly affect the baby's development. My name is Dr. Olivia Grant. I am a clinical psychologist specializing in perinatal mental health, and I am passionate about educating healthcare providers on recognizing and mitigating the impacts of stress during pregnancy. Joining me today is Dr. Mark Edwards, a registered OB/GYN, who has extensively researched maternal health interventions that promote mental well-being during pregnancy. Dr. Edwards' work focuses on practical approaches that support both maternal and fetal health. As healthcare professionals, we know that the landscape of mental health care is evolving, and it's crucial for us to stay updated with evidence-based practices that might not have been covered in our initial training. This session is a valuable opportunity to deepen our understanding of a topic that continues to grow in significance as new research emerges. The primary objectives for today's session are to discuss the physiological pathways through which maternal stress affects fetal development, review the mental health impacts that may carry into infancy and childhood, and explore practical interventions like mindfulness, exercise, and nutrition that can help mitigate these impacts. We will begin with an overview of the pathways of prenatal stress and its biological impact on fetal development, then break into smaller groups to analyze studies and discuss effective intervention strategies. Let's start by examining how stress in the mother's body affects the fetus. When a pregnant woman experiences stress, her body releases stress hormones like cortisol, which can cross the placenta and enter the fetal environment. Research has shown that high cortisol levels may influence fetal development, particularly brain development, which may increase the risk of behavioral and emotional difficulties later in life. These findings highlight the importance of early intervention to support maternal mental well-being.
Another area of study in prenatal stress is its potential link to preterm birth and low birth weight. Stress-induced cortisol has been associated with shorter pregnancies and, in some cases, lower birth weights. These outcomes can have long-term health implications for the child, potentially impacting their cognitive development and immune system functioning. Now, let's talk about interventions. Evidence-based approaches like mindfulness practices, proper nutrition, and regular physical activity have been shown to effectively reduce stress in pregnant women. For example, mindfulness practices such as meditation and breathing exercises can decrease anxiety and improve mental resilience. Nutritional choices, especially increasing intake of omega-3 fatty acids and reducing caffeine, can also help regulate cortisol levels. Finally, moderate exercise has been found to be highly beneficial in managing stress and improving overall well-being during pregnancy. These interventions not only support the mother's mental health, but also help create a more balanced in utero environment for the fetus. In the breakout sessions, we'll look at research articles exploring these interventions in more depth. We'll review studies that detail the benefits of maternal nutrition on fetal brain development, the effects of exercise on maternal cortisol levels, and the positive impact of mindfulness on reducing prenatal stress. Now, I'll turn it over to Dr. Edwards to discuss the specific physiological impacts of maternal stress and strategies for healthcare providers to support expectant mothers.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Linda Cohen discussing cyberbullying. Now, read the questions. You now have 90 seconds to read questions.
Today, we're discussing an issue that has escalated with the rise of technology, cyberbullying, and its impact on teenage mental health. To help us understand more, I'm joined by Dr. Linda Cohen, a psychologist specializing in adolescent mental health and online behavior. Dr. Cohen, thank you for joining us.
Thank you for having me. Cyberbullying is indeed a major issue affecting adolescents, with consequences that can be profound and long-lasting.
To start, could you give us an idea of just how prevalent cyberbullying is among teenagers?
Certainly. Studies show that nearly 1 in 3 teenagers have experienced some form of cyberbullying. The majority of these incidents go unreported, as teens often feel ashamed or fear retaliation. Unlike traditional bullying, which might be confined to school hours, cyberbullying can happen around the clock, making it harder to escape.
That's staggering. And what are the common types of cyberbullying that adolescents experience?
The most common types include harassment through social media, hurtful comments on posts, spreading rumors, and exclusion from online groups or communities. Additionally, there's a growing problem with impersonation, where bullies create fake profiles to tarnish a peer's reputation. It's worth noting that even small, seemingly trivial incidents can have a serious impact if they occur repeatedly.
I can imagine that enduring this type of bullying would take a toll on a teenager's mental health. Could you talk about some of the psychological effects?
Absolutely. Adolescents who experience cyberbullying often suffer from a range of mental health challenges, such as anxiety, depression, low self-esteem, and even suicidal thoughts in severe cases. One of the reasons cyberbullying is so damaging is that it targets an adolescent's sense of self-worth and belonging, which are already fragile during this developmental stage.
That makes sense, especially since teenagers are naturally inclined to seek validation from their peers. Do you think technology itself, like social media platforms, contributes to these mental health struggles?
Without a doubt. While technology can be a positive force, social media creates an environment that encourages constant comparison. Adolescents are comparing their own lives to what they see on these platforms, which can create unrealistic expectations. When cyberbullying is added to the mix, it can amplify these insecurities, making teens feel isolated, inadequate, and even humiliated.
What about the role of schools and parents? What can they do to support teenagers dealing with cyberbullying?
Schools and parents play an essential role in addressing cyberbullying. Schools can implement policies that clearly define and prohibit cyberbullying, and they can establish safe reporting mechanisms. Parents, on the other hand, can maintain open communication with their children. They should encourage teens to talk about any distressing online experiences, reassuring them that it's okay to seek help.
I imagine that prevention is also important. Are there strategies for preventing cyberbullying?
Prevention is crucial. Teaching teens digital etiquette, empathy, and the responsible use of technology can reduce the likelihood of cyberbullying. Schools can provide workshops or training on online conduct, and parents can model positive online behavior. Creating a supportive environment in both school and home settings can help teens feel safe and respected, which can deter bullying behavior.
And if a teen is already a victim, what steps can they take to protect themselves?
Victims of cyberbullying should try to document the incidents by saving messages or screenshots. This can serve as evidence if they choose to report the issue. They should also block or mute the bully to limit exposure and avoid responding to the bullying, as engaging can sometimes escalate the situation. Seeking support, whether from friends, family, or school counselors, is also essential.
It sounds like there are practical steps both teens and their support systems can take to mitigate the effects of cyberbullying. Do you have any final thoughts on the broader impact of cyberbullying on adolescent mental health?
Yes, I'd like to emphasize that cyberbullying not only affects individuals, but also contributes to a broader culture of online hostility. When we see cyberbullying normalized, it can have a cumulative effect, creating a more aggressive digital environment. We need to remember that every individual action matters. Promoting kindness and empathy in all interactions can help build a healthier online world for everyone.
That's a wonderful reminder. Thank you, Dr. Cohen, for shedding light on this important issue and for your practical advice on how we can better support adolescents facing cyberbullying.
Thank you. It's been a pleasure discussing this with you.
That is the end of Part C. You now have 2 minutes to check your answers.